The female reproductive system contains several layers of soft tissue designed to remain flexible and protective. Near the vaginal opening, there is a thin structure known as the hymen. The hymen is a small membrane-like tissue that naturally varies in shape, thickness, and flexibility from person to person. In some individuals, the hymen contains more elastic tissue and stretches easily. In others, the tissue may be tighter or contains small blood vessels close to the surface. These natural differences explain why body responses can vary. During first intercourse or other forms of stretching activity, pressure may cause the hymen tissue to stretch. As the tissue expands, nearby tiny blood vessels can also experience tension. If the stretching becomes greater than the tissue's flexibility, small surface-level separations may occur. When these tiny blood vessels break, a small amount of bleeding can happen. This bleeding is usually minor because the blood vessels involved are very small. The process is related to tissue stretching and blood vessel response rather than a large injury. However, bleeding does not happen in every case. Some hymens are naturally flexible and may stretch without tearing. In other cases, physical activities such as sports, exercise, cycling, or tampon use may already have stretched the tissue earlier in life. The amount of bleeding, if it occurs, can vary greatly depending on tissue elasticity, blood vessel position, and overall anatomy. In many individuals, there may be little to no bleeding at all. Once minor tissue separation occurs, the body immediately begins its repair process. Blood clotting mechanisms activate to stop bleeding, and healing cells begin repairing the affected area. Because the tissue is small and highly supplied with blood circulation, healing usually happens naturally over time. The hymen is simply a naturally variable tissue structure within the body. Its appearance and response differ widely between individuals due to normal anatomical variation.